Greetings. I'm Dr. Franklin Chow, one of the delivery specialists for the Colorado Fetal Care Center. I serve currently as the Director of Labor Service. I oversee all the deliveries at our unit. I was asked today to talk to you about the setup that we have in our labor and delivery unit. The Colorado Fetal Care Center is unique in the sense that we're one of the few hospitals in the nation that has a labor and delivery unit situated in a children's hospital. This makes life easier for our pregnant moms who carry babies with abnormalities since they are in close proximity with their babies when they deliver. The experts in our multidisciplinary teams include neonatology, cardiology, urology, neurology, pediatric surgery, and pretty much the entire spectrum of subspecialties. Our maternal fetal medicine team are the consultants for all the referrals to the Fetal Care Center. My inpatient OB team, as well as the anesthesia team, takes care of all in-hospital patients 24/7. The academic achievements of our center has been well published and reviewed in other videos. I want to concentrate on our labor and delivery inpatient unit itself today. Since the inception of our program 10 years ago, we have now over 2,200 deliveries at our unit. Our overall C-section rate hovers around 48% for all comers. It varies slightly depending on the referrals. I like to set aside the fetal diagnoses in utero that requires abdominal delivery and talk to you specifically about patients who are candidates for trial of labor. We have quite a good statistics from the inception of our program till now. Our overall success rate on the trial of labor patients is about 83% with a C-section rate of about 17%. Over the years, it has remained pretty constant. This is a tremendous achievement that is not advertised. Even in a regular OB unit, delivering regular non-high-risk babies, the statistics around the nation is probably somewhere in the 30 to 33% rate. We have been able to achieve better vaginal delivery rates despite the fact that we care for moms carrying high-risk babies. How well we do depends on the diagnosis of the babies. About 38% of our babies have cardiac issues, and we found that a lot of these babies, contrary to popular belief, can withstand the rigors of labor. Our cardiology team has been able to advise us which babies can tolerate labor. For those diagnoses that is not suitable for labor, we reduce the stress to the fetus by performing scheduled C-sections. Our evolving knowledge has shown us that we can achieve better than 80% vaginal delivery rate on most cardiac babies. Our hypoplastic left heart babies cleared by cardiology to undergo trial of labor has over 90% success rate for us. We are very proud of that result as we are able to utilize information that we've gathered from our own patient population. On the non-cardiac side, we have just as good numbers. The overall rate is probably 75% vaginal and 25% C-section. For the congenital diaphragmatic hernia, who does not need ECMO standby, is 83-17. We also learned that a diagnosis of intrauterine growth restriction associated with any cardiac diagnosis increased the C-section rate to 60%. So we know these babies don't tolerate labor well and adjust our management accordingly. On the non-cardiac side, the stats are similar. Our gastroschisis babies have probably a 33% C-section rate, but would double if growth restricted. We're continually working to provide the best obstetrical care to this subgroup of patients and optimize their outcome. If you have any further questions, please feel free to contact the Colorado Fetal Care Center for more information.